Well, Wab Kinew was first elected as MLA in Fort Rouge in 2016. In less than a year, he became the leader of Manitoba's NDP. He is a former journalist, rap artist, an author, and an honorary witness of the Truth and Reconciliation Commission. Let's welcome Wab Kinew for our conversation and interview. He is the leader of the New Democratic Party of Manitoba. Welcome.
Hey, thanks for having me, Marcy.
Thanks for being here at CBC with us.
Yeah, it's great to be here.
So let's start with this province and the state we're in.
Yeah.
What do you see as the biggest division in Manitoba right now?
I think that coming out of the pandemic, we were so stressed out and it had such a toll on all of us that it really is time to bring people together again in Manitoba. And we've sort of staked our campaign on that belief. You know, our campaign slogan is "Make Life Better Together." The idea that we do have these big challenges like healthcare, the cost of living, not to mention, you know, the fact everyone's on their own kind of social media avenue, that it really is time to bring people together. And so I think that these big projects before us are a unique opportunity for us to say, yeah, we want to fix healthcare, so let's build a consensus to do that.
I'm going to ask you about healthcare specifically in a moment, but when it comes to the point about on social media and the division that you alluded to there, what would you do specifically if elected to address that, where the divides can be deep, to bring back people into the fold? How are you equipped to lead those conversations in this province?
Well, one of the things that I've tried to communicate to Manitobans in this campaign is that we don't have to agree on everything. We don't have to agree on everything in order to do the big things together. And so there may be a difference of opinion on some issues of the day, but I think we all know that we want to make the cost of living more affordable in Manitoba. So let's focus on those economic issues together. We all know that healthcare needs to get improved, so let's focus on working on healthcare together. And then hopefully, if we recognize that there's that consensus on the big things, then maybe we can have a difference of opinion on some other issues, but still know that we're fellow Manitobans, fellow Canadians, invested in one another's futures.
Healthcare. You've promised to reopen emergency departments at 3 Winnipeg hospitals. An ER physician, however, told CBC that that would likely require hiring hundreds of workers in the middle of a staffing crunch and restoring support services that were cut from the hospitals. So my question is, how realistic is your plan?
Very realistic, and actually what that emergency room doctor is articulating is our plan. We said at the outset that staffing has to come first. Like, our first healthcare commitment was on staffing, and specifically to hire 300 nurses in the city of Winnipeg and another 300 in rural Manitoba. So if we do that over the first 2 years of a mandate, should we get the honor of serving, then we'll be in a position to move ahead with the emergency rooms. So I hope.
How are you going to do that, though? Because it's not like the PCs haven't been trying to recruit nurses, and the gap is big. So 300 nurses, I just want people to understand the real numbers. We've been told there are more than 2,000 vacancies.
That's right.
So you're 1,700 short just in the vacancies to begin with. Never mind all the other staff that it would take to run an ER.
Yeah.
Specialists, it would need it. So it's a big promise. It feels short on details.
Well, the 300 nurses is the 2-year target, and then we keep hiring after that to get to that other 1,700 that you're talking about. But in the question of how do we do it, one, we got to be competitive with pay. We have to improve working conditions. But one thing that our team is really focused on that I don't think the current government can deliver on is to improve the culture within healthcare. Part of the reason why we're losing so many nurses and other healthcare professionals is because the culture within healthcare is focused too much on some of the upper management targets, but not listening to the front lines. And we need to reverse that culture if we want to keep people working on the front lines and add more. So it's really about investing not just resources, but also decision-making power in those people who are at the bedside. And that's where our plan starts.
Now, you just said in terms of attracting nurses, you said pay.
Yeah.
Does that mean should NDP form government, you're going to increase pay for nurses and change that in Manitoba to attract more people?
Yeah, and we'll include some people who are left out of the current incentive programs, like nurse practitioners, for instance, because NPs, nurse practitioners, are a very, very important part of meeting our needs around Manitobans who don't have a family doctor, who don't have access to primary care. And that's both in Winnipeg and in rural Manitoba. So again, our first healthcare commitment was a $500 million human resource plan over a term in government, and that is the first priority. Nothing else that we want to have happen in healthcare will take place unless we have the staff to do so.
So you start with 300 in the city, and then you said 300 rurally, and then you continue on the trajectory to get to the 1,700.
Exactly.
How long will it take to fill all of the positions, and then plus what you're going to need to staff ERs?
It could take 7 or 8 years, if we're being realistic. But our plan is judicious, it's common sense, and it's something that we're committed to implementing over a series of time. Because again, it took the PC 7 years to bring our healthcare system to this position. And I think realistically, we should expect that it's going to take 7 or 8 years for us to get back to the place where we need to build Manitoba's healthcare system for the future.
You've made many pledges around restoring all kinds of different services in the province. So at the end of the day, what's the price tag for all of the promises?
In the healthcare system?
In your whole plan.
It's less than $500 million a year.
For all of the promises
Correct.
you made?
Yep.
So the PCs have costed your promises at more than $3.2 billion. You're saying that it's that far off?
The PCs are desperate, and you're going to see them continue to get more desperate in the coming week.
So what's the costed? How does that big number you just gave me, how does that break down into healthcare then?
The healthcare number is $125 million annually for staff incentives, and then a series of additional investments into some of the buildings like the cancer care headquarters and the new emergency rooms. But the thing that you have to remember about standing up a building is that it's paid off over a series of years, just like your mortgage on the house. But for a government, when they stand up a piece of vertical infrastructure, it's a 40-year term. It's amortized over 40 years. So again, when we're looking at the specific 1 year amount for the investments that we're talking about, it's less than $500 million, and we have the money in the budget right now to be able to do those things.
Some Manitobans might not like debt financing over 40 years. They might think fiscal responsibility matters in the current moment and in this climate. What would you say to them?
Oh, this is just the rule. This is just the way that the government has to pay for buildings when they build them.
Let's move from affordability for people at the individual level. So aside from cutting the gas tax and freezing hydro rates for a year, what other tax cuts would you consider to helping Manitobans who are struggling?
Well, I think housing is such a big issue right now, right? The Manitoban who is starting their life and is trying to save up for a down payment, the seniors who are living on a fixed income. And so that's why we've proposed a $700 renter's tax credit that'll help people on fixed incomes, that'll help the young couple save to be able to make a down payment. And then when we're talking about the housing stock, to your question in particular, we're saying we're going to take the PST off of new rental unit construction in Manitoba. Right now there's a lot of capital that's sitting on the sidelines because of interest rates being so high. And so this is one financial incentive a government can take to ensure that there's more rental units being built. That's going to help everyone be able to access housing more quickly. It's also going to help on the affordability side with more supply.
And you feel there's enough money for you to be able to make all of these promises and achieve all of these things you're talking about?
100%.
Already there?
Yep, that's right. Under the PCs, they have put more than $500 million, $520 million annually in unallocated funds. And right now what happens is March Madness rolls around the end of the fiscal year, and they use that for mailing checks to everybody or whatever their idea of the moment is. And what we're saying, our fundamental fiscal idea, and what we think is more transparent, more fiscally responsible, is instead of just waiting for March Madness to spend that $500 million that's already in the budget, we're going to tell you right now that we're going to spend that on healthcare and making life more affordable.
I want to turn to parental rights. Do you think that parents should be informed by schools if a child expresses a different gender than what they were assigned at birth?
Well, I think that the first thing I want to say is that I'm never going to come between you and your child. And I think parents have a right to know, but children also have a right to be able to express who they are, what their identity is. And so I have a lot of trust in teachers, a lot of trust in young people, and a lot of trust in parents. And what I think the role of a real leader is to do right now is to bring people together, to articulate what that's going to look like in Manitoba.
So parents have a right.
The divisive nature of what the PCs are trying to do on this issue, I think, is the exact opposite of what we need in our province today.
But if you lead all of the families in Manitoba, and parents have a right to know, and yet if a child doesn't have a safe home environment where that parent, maybe could or should be informed, do you follow the lead then of the teachers, or how do you govern? What do you do with that?
This is why we need to bring people together to sort through these difficult issues. But for the PCs to try and inflame sentiment on this issue because they're desperate in an election campaign, I think is the wrong approach. It's very divisive. And frankly, we don't need to be divided in Manitoba anymore. We need to bring people together.
If you win, as you well know, you would become the only First Nations person to ever hold the title of Premier of Manitoba. What would that mean to you personally?
I want to be the best premier that I can be for the people of Manitoba, because that's what you deserve. So again, I know that I would have a responsibility to First Nations youth, Indigenous youth, but again, all youth in Manitoba, to do things in a positive way and build our province up for the future. But my campaign and my career in politics is not about being the First Nations Premier of Manitoba. It's about being the best Premier that Manitoba can get, because it is about building this province for the future on issues like healthcare and affordability.
But if you make that history, I'm looking for the personal answer. You got to look at yourself in the mirror. If you do make that history, what will it mean to you?
We're still one vote behind, and I still have more than a week to go out and earn the support of people of Manitoba. And that's the job that I'm focused on right now.
We'll leave it there. Good luck
Thanks so
on
much.
October 3rd, Wab Kinew. Thank you.
Thanks, Marcy.